Hi everyone, my name is Amanda Burgess and I'm a research associate at the University of Southern Maine, and I'm here to talk to you about our project titled Telehealth Use in Maine, a Mixed Method Study. I just want to give a quick shout out to all the team members that are listed on this first slide. This was truly a team effort. So we went into this study with three main research questions. The first thing we wanted to do was describe the demographic characteristics of telehealth users in Maine. The second thing we wanted to do was assess trends in telehealth use across time, payers, services, and virality. We also wanted to identify facilitators and barriers to telehealth adoption and use in the state. So to get to our first two research questions, we used a quantitative approach. We took 9 years of data from Maine's all-payer claims database, 2008 to 2016, and we also used zip code level rural classifications to get a sense of how service use was different for patients in rural areas and patients in urban areas. The qualitative portion of our study really gets to the last research question we had about facilitators and barriers to telehealth adoption and use. We interviewed 16 key informants from 14 healthcare organizations in Maine, including health systems, independent hospitals, FQHCs, and home health agencies. So let's start by digging into some quantitative findings. And the first set of findings I'll address are related to our first research question about the characteristics of telehealth users in Maine. So we took a rural-urban slice of the APCD data and found that a larger proportion of rural telehealth users were age 65 or older and female. We also used the Johns Hopkins ACG grouper system to assess the health status of rural telehealth users compared with urban telehealth users. And we found that the patients in rural areas had poorer health status than the patients in urban areas. So let's jump into these figures. Figure 1 shows the growth in telehealth claims over time. This version of the figure is broken out by rural classification. And as you can see, the rural total line is the largest proportion of telehealth claims. So this is a 14-fold increase between 2008 and 2016. But actual rates of use remained quite low. So in 2008, 0.02% of individuals in the APCD had a telehealth claim. In 2016, 0.28% of individuals in the APCD had a telehealth claim. So there is growth from 0.02 to 0.28, but the rate of use is still quite low. Figure 2 shows the breakdown of primary payers on these telehealth claims and the rural-urban breakdown as well. And the main takeaway here is that about 70% of the telehealth claims in Maine are going through Medicaid. And the third figure on this slide shows differences in the types of services that are being provided via telehealth to rural patients and urban patients. So among patients with a rural residence, speech-language pathology services made up the largest proportion of claims. But if you're looking at telehealth services provided to patients in rural and urban areas, psychiatric services make up the largest proportion of claims. So now for our qualitative findings and wrapping it up. When I read a claims-based analysis of telehealth use, generally one of the limitations is underbilling. You know, the extent of underbilling is really unknown, and we saw the qualitative component of this study as an opportunity to get more information about underbilling. And what our key informants told us was that reimbursement complexity is really at the root of underbilling. We also heard that certain services, particularly provider-to-provider consults, were frequently not billed because they were seen as more of a professional courtesy rather than a billable telehealth service. The factors driving telehealth adoption and use included the telehealth-friendly Maine care policies in our state, clinical champions at every level of the organization, and grant funding, especially for those smaller organizations. The factors impeding telehealth adoption and use were in two major buckets: reimbursement-related factors and technology-related factors. So in conclusion, I just want us to think about how different the world is now than from when we did this study. There have been a lot of telehealth-related policy changes due to the COVID-19 pandemic, and also major investments in broadband and telehealth. And it'll be interesting for follow-up studies to look at how that has impacted rates of use in Maine.